All right. Well, welcome, Elaine.
Hey, Elaine.
Hi, Sam and Shar. How are you?
Yeah, and that was Jules. Hi, Jules.
Oh, sorry about that.
We have similar voices.
And doing this forum too much. We're starting to sound alike.
We're becoming twins.
There we go. I'm okay with that. That works.
I'm just the older one. And then we have Susan on too. Hi, Susan.
Hello, good morning,
Hey,
everybody. Hi.
I always love a full group. The energy is always so much more fun and, so many more fun faces to work with. It's great.
Oh my gosh, I just am so proud of our forum. We have been doing this since, I think, March of last year. And if you were to go back, and I think that we're on YouTube, right, Sam?
Yeah.
And all of our old videos are on YouTube, Sam?
That's right. Yep. They're all on there.
You guys, honestly, I would suggest instead of watching some of those TV broadcasts that are negative, I think you'd have a blast watching our old people strategy forums, because it's kind of like historic, because we kicked it off right when COVID hit, and Sam and I had a TMA, like an in-person executive meeting scheduled.
That's
and then
right.
that got canceled, right, Sam?
Yeah, definitely. It got canceled. And then the People Strategy Forum was born, right? That's what.
No, it was the HR forum.
That's right. Yeah, HR started off the HR forum, and we talked a lot about how companies should react to the pandemic and give them advice. That was great.
And then after a couple of months, we said, well, let's broaden this and let's call it the People Strategies Forum.
That's right. Yeah.
And where can people find that link? Just for people to know. The YouTube link.
The YouTube, if you go to YouTube and you search for People Strategy Forum, and the page will pop up with all the recordings. So I think we're over 60 sessions now, 60 episodes. So,
wow.
Yeah.
And you can watch all of Shar's backgrounds change.
Yeah.
and my skin
All over the world.
my skin changes color too.
That's true. Yeah.
Sometimes I'm ultra light skinned, and sometimes I'm ultra dark skinned.
Yeah. Quite fortunate, depending on if you're the North or South America, right?
Right.
All right. Well, we are at the top of the hour. So Jules, you want to go ahead and kick us off?
Yes. Welcome, everyone. We were just, doing our usual thing, just chatting, getting a little warmed up, waiting for people to hop in. But now we're going to get straight into it. We have a fantastic panel for you today. I know you're going to love it. It's going to be a fun conversation. And if you've never joined us here at the People Strategies Forum, welcome officially. Just to give you an idea of what we do here, if you hopped on a little earlier, you might have heard we are going on over 60 sessions now. We've been very consistent and it's grown. We had like a really great turnout last week, which was awesome. And we appreciate that you come each and every week. But this really is a mastermind of leaders, and we're dedicated to really creating workplaces where people will thrive, where employers reward and customers love. And we do that by bringing a different guest speaker each and every week on different topics to help you. And to introduce myself, my name is Jules, and I help host the forum. I also sit on the sidelines during the conversation and field the chat for any questions or comments you might have. So I really encourage you, be interactive, share your thoughts, share your questions with our guest speaker, and we'll make sure we get those answered. But if if you're not on the Zoom call, that's okay. Still put your questions down. We always get to those at the very end. Now, I'll introduce you to the rest of our lovely panel here. We have Shah, who, we were just talking about your HR background. She has over 25 years of HR experience. She took all that experience in talent management and HR and formed her own company, Rocky Mountain Health Advocates. And so today she's actually brought in the director of Rocky Mountain Health Advocates, and that's Susan Venters. So welcome, Susan. We're excited to have you. I met you before when we had Shah on, and we were talking with a lot of your other co-workers. is.
Yeah.
So isn't Susan's first time here. She kind of knows the drill. And of course, we have Sam, founder and CEO of Comp Team. Sam is the expert with all things compensation, talent initiatives, and rewards. And then I'm also going to introduce you to our lovely guest speaker. Sumit, I believe he isn't going to be able to join us today, but Sumit occasionally hops on here and there. Now, our guest speaker has so much experience. We are talking about taking care of employees with healthcare advocacy. So no one better to speak to us about this than Elaine O'Blennis. She actually hops on the forum. She tunes in quite frequently. So it's really cool to have a very consistent listener and follower speaking to us today. Now, she has over 30 years of healthcare management experience as she's worked with companies like Banner Health and Cerner. And then she recently took all of her healthcare experience working with all kinds of organizations in the healthcare field. And she started her own practice in patient advocacy. And that name is Health Information and Patient Advocacy Associates. Yes, I had to read that because it's quite a lot and I didn't want to mess that up. But she offers services to different businesses for their employees. So welcome, Elaine. How are you doing this morning?
I'm doing great. And Jules, I really do apologize that I'm in Northern California, in fact, and I don't, my Zoom is didn't get up. So I'm joining you this morning by phone.
But see, we love the dedication and commitment. You're here. That's all that matters. We can hear you clearly. So it's all good.
Excellent. Excellent.
And
So
before we get started, I want to say Elaine is like, when I used to be her HR director back in the day, Elaine and I have worked together for over 21 years, believe it or not. And I'm so super proud to have Elaine on because she's supporting my company today. So thank you, Elaine, for joining us. I just absolutely love you.
Thanks for the invite.
So
I wanted to talk to you a little bit about health advocacy, right? For employees. So Jules, when you have the slides up, just let me know, okay?
I think Sam's got them for you. Right, Sam?
Yep, it's up. First slide's up. What if?
We can see it. So we can get into it.
All right, great. So we want to talk this morning a little bit about what a patient advocate and navigator and could do for your employees to help your employees. So I always like to play the sort of the what if game. So what if you had key staff in your organization that had to miss work for and really important deadlines to assist their family members or their even close friends that were seriously ill and battling the maze of the healthcare system? You know, 53 million, can you believe it? 53 million Americans are absent from work each year to assist with the health care of their family and friends. 70% of that 53 million Americans suffer some sort of work-related difficulty because of it. Like, for instance, they have to reduce their hours. They have to take a demotion. There are performance warnings, loss of benefits, and they may even have to give up working entirely for a period of time. They say that caregiver absenteeism costs the U.S. economy $17.1 to $33 billion annually. Next slide.
Now, wait a minute. Before you proceed, Elaine.
Okay.
I just want to share a personal example. Back in 2016, my daughter had a health crisis. My mother was critically ill and passed away in May of 2016. I was having a horrible time dealing with the bills, helping my mom and my daughter get into doctor visits and managing that, plus being a regional director of a huge healthcare system. And so I do understand the what if. It was one of the most hardship times in my life. In addition, I bought a new home, and my ex-husband had a critical car accident as well. And it all happened in one month. And these are not just elderly people. We're talking younger people that was ill, and I could barely concentrate on my job. So that's just an example.
Absolutely.
That's a great lead in, Shar, because next slide. What Shar's talking about is what if several of your key staff, like Shar, they're not missing work, but they're at work and they're worrying about all kinds of medical issues for themselves, for their loved ones, including just like she said, payment of the medical bills, where are the medical bills coming from, et cetera, et cetera. That's called presenteeism. The staff are at work, but they're completely distracted and they're completely worn out. And they spend a good part of their day tending to personal or family health related issues, making calls, trying to set appointments, et cetera, et cetera. The statistics say that this reduces productivity by more than a third. And nationally, it costs the economy the same amount as absenteeism does. Next slide. So what if you had an employee benefit? You had health advocacy and navigation as an employee benefit. You could help your employees navigate the maze of the healthcare system. And Jonathan Marcus, who's the manager of compensation and benefits for a think tank in Alexandria, Virginia, says that they have used advocates for their employees to resolve claims issues, to file appeals for insurance denials, to get general information about insurance plans, to find doctors, to research support for specific health conditions. Those are the things that a patient advocate, a health advocate, or a navigator can do as an employee benefit.
And so, I'm sorry, Elaine, not to interrupt you here, but may I just interject here, because we try to keep it conversational. I wanted to introduce Susan. Sure. And so while you're still on the slide, Susan, what is your perspective about this presenteeism and how your employees at Rocky Mountain Health Advocates have been distracted at work? What is your opinion about that?
Absolutely. I think that this is such a great benefit because we do have one individual in particular that has been struggling with her own illness, and she's been very, very distracted because she has, she's kind of facing that scenario where she's about to lose her insurance. And it's terrifying for her because she has a pre-existing condition that is a pretty serious condition that is completely distracting to her because she's so worried about that she can't focus on her job at hand. And so Elaine has been such a blessing. She came in and has assisted our employee with figuring out the healthcare system, with figuring out exactly which insurance she could take, what she can do when she leaves her parents' insurance. And I went and visited with this particular employee yesterday, and she was talking to people, she was active, she was happy. And so she and I kind of got into the discussion about Elaine and her working with Elaine. And she says, I can't thank you guys enough for offering this benefit to me, because Elaine has helped me so that I can focus it. She has helped me with the insurance piece, so that's not constantly on my mind. I can focus on other things, and I can think about my job and my performance and my responsibilities here at work, as opposed to, she says, it was constantly weighing on my mind. What am I going to do? What am I going to do? I don't know what to do. And she felt very, very lost. And so thankfully, Elaine has really helped her to be able to navigate through. And now her mind, she says, I can sleep at night again because I don't worry.
And don't you also say that, Susan, that you also had to give this employee some negative feedback or not so positive feedback about her performance?
I did.
How did she react about that?
So I had approached her about a week ago with performance questions and concerns. Her performance was quite low, and we had noticed a decline. And that's, she opened up to us and said, I'm struggling with this. This isn't something that I like to talk about, but it is something that is continually on my mind. And setting her up with Elaine has eased all those fears and has really helped her to become a much more productive and much better employee, a much more focused employee, to where she isn't the presenteeism. She was there physically, but she wasn't engaged in her job responsibilities. So now that this piece has kind of been taken care of, and she feels so much more confident about her future, she's able to focus on her job.
Thank you.
As a case example, using that employee, and of course we do have her approval to use her as a case example, so this is not any kind of a HIPAA violation. When she approached me in the beginning, she was extremely distraught. This employee has a very serious health condition. In fact, it's MS. She has told me that it's just fine to give all of her information. Of course, we're not going to use her name. And she approached me and told me that she is 25 years old, and as of September, I believe, she's going to be 26, which means she ages out of her parents' insurance. I'm just giving this as an example so people understand, what we did for this employee. And she did not know where to turn because her medications are several $1,000s a month, and her medication is a very new and wonderful drug that has had her in remission over 6 years. So in other words, she has to have her medication. So what we did is we did a lot of research about MS and found several foundations that can help with co-pays and out-of-pocket expenses, which she will need to apply to. And then also she found a health broker. She took the initiative to call me and ask me if I would go with her to the health insurance broker. We went and had a meeting with the health insurance broker. He found her an ACA plan that was very reasonable as far as premiums and cover, and he did all the research to make sure that her particular physician and her particular medications were covered. And so that is an example of what and this employee said to me, if I or my parents have to pay you, that's fine. And I said, oh no, this is a benefit that is offered to you by your employer. And she has told me several times she cannot believe that an employer would offer this type of benefit.
Thank you, Elaine. And so as a business owner, I'm the business owner of Rocky Mountain Health Advocates. We do have medical benefit, but it's more of a co-op. We can't quite afford, as a startup company, we're only a few years old, a very expensive medical benefit program. But we offer dental and also several other benefits. But partnering with Elaine, so what I think I understood that you said, Elaine, is that this employee acknowledged that our benefit, I mean, I'll just be candid, it didn't quite meet her needs with her pre-existing condition, right?
Well, it's because they cannot deny a pre-existing condition, but she has it is not a true insurance. Like you said, it's a co-op, and it's the cost of the medication every month that would preclude her from that insurance. And
can you share how much her medication? Can you share how much her medications cost her a month?
Her response to me about that is $10,000 a month.
So can you imagine now, again, let's go back to my original story where I talked about my mother. My mother was only 64. So my mother also passed away very young. And now it's sometimes interesting as a business owner or a director like Susan or a senior leader, when we're trying to talk about benefits to our employees, it's very common that the younger employees will say, I'm healthy, I have no problem, don't worry about me. So one, they don't even sign up for the benefits. So benefit coordinators out there, you know what I'm talking about, right? We're talking about those open enrollment periods, and we're trying to get our employees to take advantage of the benefits. But there's a percentage, and Sam might even know the percentage, I'm not a numbers person, but there's a percentage, right, under total rewards and compensation that say they don't even want to take advantage of the benefit, right, Sam? If you can't say anything, nod your head.
No, that's all right. Sorry, I was concentrating on the chat here, so I didn't hear what you said. So you had to move on without me there, Shar.
Okay, yeah, but I'm just saying is that there was always a percentage of our employees that didn't take advantage of the benefit. Now, imagine me, you know, starting this big 6-figure position with a big healthcare system and trying to support my family. And I literally had 4 major life incidences happening at the same time. Now, Elaine and I knew each other, but we had worked together. I think I left Banner back in, oh gosh, I think it was 2012 or something, Elaine. And I laughed because Elaine was so sweet. I think, Elaine, you called me and gave me some compassion because we were Facebook friends or something, you know, about my mom, you know, and all that.
Exactly.
Remember?
Mm-hmm.
Now,
Right.
Had you been in this role, I would have definitely hired you. And you said you had like a subscription program too, that could have helped me with my mom's serious, my mom passed away from a brain hemorrhage. So in my home, but only 2 weeks prior to that happening, I was with my mom in the medical office who basically cleared her bill of health. And I was completely confused because my mom was on a bag full, like 12 medications. And I didn't understand all these medications. I had no clue what all these medications were. And my mom was reluctant to tell me because she had pride. And I heard from one of my Hispanic leaders that some people have pride. They don't want their children to know the types of medications that they're on. And those medications might be conflicting with one another, right, Elaine? So
that's exactly right. And
had I had you,
that's the kind of thing that a health advocate can help you with as far as your family, even your family members. You know, you can research the meds, you can research the condition, you can research and give encouragement about you never tell the client what you think they should do, but you can give all of the information that you've obtained in research about second opinions, about meds, about, you know, different health offerings that are in the community, and very, very frankly about insurance plans.
Yeah, so important. I mean, and we just these issues when they come up. I mean, a couple of weeks ago we talked and we had a Warren speak from the Birches Group was talking about kind of like disaster recovery from large economic calamities that can happen to the workforce. But we also need to look at these individual crises, right? I mean, these make a significant impact on our people. And I know a lot of people that are listening out there have been in this situation where something happens with a family member. You know, is this, you know, the first thing that goes through your mind is if you're far away is, Jesus, is this critical? Do I need to jump on a plane right now and get there? Or was my best time spent in trying to find solutions that are currently exhibiting the right doctor, these things. I mean, there's all these things that are going through your head, this crisis, and we don't know how to handle it. And having a resource, an expert that knows how to deal with these things and on a regular basis can be a huge relief to our employees and just individuals.
Exactly. even the executives in a company. I remember one of the hospitals systems that I worked in. My VP was absent from work when his parent passed away for over a month, and even previous to that month, that was the end of life, he spent most of his day trying to figure out the medical bills for this parent as they were involved in the healthcare system for end of life issues.
And I would just share that it's a major impact, as we know that when an executive, and I think I remember this example, but you can't really disclose to your entire employee population why this executive is missing or
Right.
absent or even not quite present, right? So
Right,
because as an employer, as we know, we also have kind of a HIPAA standard with our employees. If like what Susan talked about is that, you know, this employee chose to disclose that she has a medical condition with us, but, you know, obviously we have to protect the HIPAA of the employee. So employees, we have another employee in a wheelchair, but he is very open and very transparent because we're health advocates, and he is one of our most top and productive employees, by the way. But like back to the executive example, I mean, that is going to just impact that company major, right, Elaine? I mean, you've seen where if we don't understand.
Exactly right. You're exactly right, and the exact same thing happened. He was a VP over several departments. He was gone for over a month, and staff got to the place where they were saying, "I bet he's not coming back." Right? I bet he's not coming back. And so, you know, I believe that a health advocate could have really helped in that situation too.
Yeah, because, you know, I think a lot of times when employees don't see their leaders, or they don't have clear communication about what's going on, then they just imagine the worst. Or they think that their VP is climbing Mount Fuji like Sam does, you know. You know, or they're on vacation, and you know, they don't that executive doesn't care about us. But you know, there's real stuff happening, but it could be all levels of the population too. So at the front line, let's talk about the restaurant industry, right?
Right.
Employers right now are having one of them that has had challenges with hiring people and retaining people. And I know, for example, the restaurant industry is going through a horrible time with this. And then also, can you imagine the health impact in the restaurant industry? Well, obviously with COVID, you know, it's very concerning if you have a sick employee, right? Right, Elaine? So it doesn't it can go all levels of the organization, right?
Through all throughout the organization, and all different types of you know, the main thing I want to get across is it's all kinds of health research that an advocate can help you with. You know, many times the employee will have all types of medical bills from all different areas. And it's really important to take those bills and literally sort them out and then reference back to the insurance coverage to make sure that you know exactly what is owed and to whom, right? And who should be paying the bill. Because sometimes the bills are not paid for a variety of you know, red tape reasons, and the patient doesn't actually owe those bills.
No
they
kidding.
don't actually owe them. Yeah.
No kidding, Elaine. That's a huge thing. I mean, we all know the dysfunction of the U.S. Health Service in that particular situation. I mean, there's plenty of times where, you know, we'll get bills from our provider because there was some, because they didn't submit the claim correctly, or there was a change of insurance coverage and they didn't have on record, and so forth. And so many people, if they're not on top of it, employees, if they're not on top of it, simply pay the bill and are out of pocket that expense when they don't need to be. So having an advocate, you know, that you can reach out to and say, hey, I got this. You know, what should I do? Is this something that I need to be concerned about? How do I prioritize this? Is a huge relief.
Yes, exactly. And that, Sam, that really happens a lot in the elder population. And obviously those probably aren't not your employees, but they are your employees' families who are trying to help their family with the bills. I can give you an example of a time, even at Cerner, and this happened to be a financial executive, and he said to me something about, my mom got a bill for she got a bill for almost $200,000 after her last day in the hospital. And I said, Pete, isn't your mom over 65? And he said, well, yeah. And I said, well, she's Medicare, right? And he said, well, yeah. And I said, Medicare pays on a DRG for inpatient stays. It's against the law to balance bill the patient. He said, are you sure? And I said, trust me, I'm sure. So 2 months later, he comes to me and he said, Elaine, you're not going to believe this. You're exactly right. My mom was ready to pay that bill.
Great
out of
point.
her savings.
Yeah.
Right. And I would say, for example, in a different example is, you know, I'm buying a house and my credit was getting impacted. And when I did some research, I learned that I had an imaginary $115 bill out there. And I was like, what is this from? And it was from many years ago. And I had no idea that my credit was getting impacted from it. So, I mean, I know that's not like medical related, but that distracted me, you know, that was like, what the heck is going on with my credit? Right, Elaine?
Right. And it is medically related, because until you get a full accounting, which is called an explanation of benefits, until you get a full accounting of where all these bills are and you start to justify them to the actual facts, you really don't know those bills are there. The only way you would have known that bill was there was to get a full accounting from your insurance company.
Right. And so, Susan, I just want to bring you in. Aren't our leaders and employees super excited about working with our company, working part-time hours, able to move into new homes and improve their lifestyles, right, Susan?
Oh, absolutely. Yep, absolutely. We have, 3 employees so far have purchased a new home in the last year. So yeah, we're definitely making dreams come true. And that's one thing that, you know, this particular employee that has this medical condition, she's so very excited to continue growing with the company because she feels so supported, and she knows that we're behind her and we will do what it takes to support her in her growth with our company. And that's something that's really hard to find elsewhere as well.
So this is like an indirect way. I mean, you would never think that having a health advocate support your employees could help them with their life goals as well, right? Such
Absolutely.
as getting a room and board, house rental, a new home, right, Elaine? I mean, there's so many indirect ways.
I have to say that all of the time that I've been in the general corporate workplace, and I hope I don't offend anyone, HR has always told us, you know, what the insurance company is, that kind of thing, you know, how much it costs and what it covers and all that kind of thing. But there's never anything on the back end, right? There's never anything about, okay, when you get this bill, or how do I know if somebody's in network, out of network? They just give you a number to call. How do I know what my coverage is for different things? How do I know that, there has been in this country so much trouble over what they call surprise billing. Maybe the anesthesiologist, maybe the radiologist, et cetera, was, quote, out of network, and the patient never knew that, right? That now is against the law. Okay, it's brand new. This law is brand new for the country. There's several states that have had state laws against it before this. But those are the kinds of things that a health advocate can help an employee with. That kind of knowledge. That kind of knowledge I have never seen come from benefits in HR.
Well, and okay, so from my experience, so I had over 1,000 employees. Well, at one point, 3,000 employees. I was kind of an overworked HR person, which is probably why I have all these wrinkles now. But anyway, but I just remember that I would go out as an HR person, not only dealing with employee relations and all those blah, 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 sitting in the boardroom, blah, 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 that I had to do, right? I also remember a lot of employees would come to me complaining about the benefits department because they felt like the benefits department wasn't helping them. We happen to have a regional benefits coordinator, but imagine a regional benefits coordinator had 11 hospitals at the time to support. And then the employees had to call a 1-800 number, as most benefits is these days, and particularly in big companies. And it's 1-800, and then you sit just like you typically do on hold for 15 minutes waiting for a benefit coordinator to get on the phone. Now imagine the what if, and this is really, I've really had these conversations, and I've also had to be in the HR person with compassion, dignity, and respect, which is our values, which Susan will go on and on about, protecting their HIPAA information, but also really concerned about helping them. And then also I had employees say, I'm afraid to tell my manager or my director that I have, let's say, MS or that I have cancer, because I don't want to be retaliated against, right, Elaine? And
because you don't want that to impact your productivity or your retention, right?
Right. My hair's almost. Yeah, exactly. So I was trying to help out the employee, and then I would try to talk to the benefits coordinators, and I try to call the 1-800 numbers myself, and it was the same runaround. And it wasn't. I don't really blame those departments, because those departments are getting reduced for staffing. That's overhead, right? Exactly. Right, Elaine? Mm-hmm. So those departments are getting reduced, and everything is getting 1-800 automized. and we've all been on those calls, right? And
exactly, daily.
And so it's not, I have to say, so now I'm the owner of Rocky Mountain Health Advocates. I've actually had Elaine come do, I think you've been to my staff meetings twice, right, Elaine?
Twice, 2 times.
Right. So Elaine was just throwing out information. She was saying, did you know there's a portal that retains all of your health information? Here's the link to get to that. Did you know this? Did you know that? Did you know this and this and this? My employees, right, Susan? They were glued to Elaine. They were like, what?
Absolutely.
What? I had no idea about these resources. Right,
a lot
Elaine?
of people didn't even know that the service existed. So it was really nice. It was an eye opener for our employees, to know that this is something that is available. I see somebody in the chat was talking about it being a dream. Really, Elaine is there to help you and to make these dreams come true, because you do want to be in tune with your employees, and then people don't know about this. So this is a service that's very helpful.
The employee that we were talking about earlier, the case study, I said to her, she said, I don't know how I can pay the co-pays. I don't know how I can pay the maximum out of pocket. And I said to her, oh, well, there's a service called needymeds.org, and they have a list by diagnosis of different organizations, foundations that have they have funds available for co-pays, for et cetera, that you apply for. Obviously, there's only X amount of dollars per year, but then if you don't get it the first time, you reapply. They have money for scholarships. They have money for students in school. They have money for camps by diagnosis, by state. It's an incredible service, and that's the kind of thing that a health navigator knows. They know all kinds of different services that are already existent in the economy.
And the fact is that we all understand, if you understand what's happening, we have a large percentage of our population as a whole moving into the boomer age, right? I mean, we have less younger people to help take care of the older population, right, Elaine?
Right. And it doesn't really matter about age, because for this particular employee, what we did is we got out on needybeds.org, and under MS, there was literally a page of different organizations that she can apply to for financial assistance.
And so she appreciates the fact that we're giving her resources. Although we're giving her free resources, free information, free tools that she can help have a better quality of life. And that's just one of our employees. We have many that have also said this to us. They say to us, "You are the best employer I've ever worked for because you care. You really care about me as an individual. You care about my family. You care about my health. But I'll tell you from a financial perspective, and I'm not the financial person, but I know that Susan, you were just on the phone this morning, right? I overheard you with Bruce, our CEO, and we were talking about the cost of one of our benefits, Susan, right?
Yep, correct.
And it was like, how much can we afford as a startup company and make it through a critical period of transition, of changing labs, of changing locations, and still keep our benefits going? So the fact that we have Elaine providing all these resources that are free, our employees are not disgruntled, right, Susan?
Correct. Mm-hmm.
Absolutely.
They definitely feel cared about, and that's the reason we're able to. We have a high retention rate with our good people, because they understand that, you know, this company truly cares about them, and we're providing these services and these options and these benefits to them because we do care, and we want them to be healthy long term, you know, not just while they're working for us, but forever, even past when they leave us. So
yeah, how can we be called Rocky Mountain Health Advocates if we can't model health?
Right. True enough.
Right.
And so Sam or Jules, do you have any questions? Because I'm not on the Zoom. So do you have any questions in the chat, or you have questions?
Yeah, so I have one. So I mean, we talked about in a lot of times we're putting pressure on our employees to perform and so forth, and at work, and these issues pop up, and for instance, they may have a health issue, and they may need some minor surgery or something like that, and they're just like, okay, well, I don't have time to look for a second opinion. I don't have time to look at alternative doctors. I don't even know where to look. So they just march down the road. So with a health advocate, what is the process of, if they reached out and say, hey, could you do some research for me? Is that what happens? They would reach out.
Exactly. They would reach out to me. They would say, you know, I have, say, osteoarthritis of the knee. That's the condition that I had. Can you help me find a knee surgeon? And so what I would do is I would go right out to Dr. Google, and I would start researching who's the best knee surgeon in this state, who's the best knee surgeon in this particular zip code, and there's all kinds of organizations like Health Grades, Becker's. There's all kinds of different organizations that you can research that information from. Then we would start to try to correlate those particular positions with the employee's insurance plan to see if you've got an insurance plan that you have to be in network. Okay, who's in network and who's not in network?
Mm-hmm.
And how far do you want to have to drive? Where's your family? Are they going to be able to assist you? Are they going to be able to be with you during the surgery? All of those kinds of things. Then you give that information to the employer or the client, and you don't make any your observations, your ideas, your opinions as an advocate do not matter. You give the information to the client, and they make the choice. But you've done the research.
Okay, yeah, that's great. Now, one other thing I think is a critical point with these great benefits that we're talking about, and the critical point is that they're useless if we don't know about them, right? So
Exactly.
Our duty as an employer and those in HR departments across the world is to make sure that their employees know about these benefits, right? And I go in time after time. I go into companies and I'll do a diagnosis. I'll look at it. So let's do an inventory of everything you got. That's what I start with. And they give me all this stuff. And then I interview employees about these different programs. And they're like, oh, gee, I didn't even know that existed,
Yeah.
or it's like and so that's so common. And to think about the waste of money and the waste of opportunity, and companies they're paying for these benefits year after year after year, and their employees don't even know about them. It's ridiculous.
It is.
So, yeah. And so
Well, and I have to say, so what happens is, Sam, is that we do these open enrollment things, right?
Yeah.
I actually did an interim HR director position for an employer with 500 employees, but they had like, I don't know, it was a good 25 locations. So I was like, okay, so where do you do your open enrollments? And they said, well, at our corporate office. Well, how many of those meetings do you do? Oh, we do 4.
Mm-hmm.
Yeah.
And I'm like, how do you get the information out to the 25 other locations? And then the HR person like me was overwhelmed, like, well, I guess it's your job to go out and educate everybody on these benefits.
Sam, I have to
go ahead.
Sam, I want to give you an example of what you're just talking about. You can't imagine how many times in my work life I have counseled employees or even friends about an employee assistance program. I would say, we have an employee assistance program. You get 6 free visits a year for you or anyone in your household. And employees would say, oh, they talked to us about that enrollment. I had no idea that we could just go to a counselor. How do I do that? I give them the number, and they usually they would do it. But what I'm just saying, I'm just reiterating this because that's an example of exactly what you were talking about, Sam. It's a benefit that no one uses.
Yeah, the employee assistance program is such an affordable benefit, and it's one of the most underused. And I remember when I first started my career, it was like taboo to use the employee assistance program. It's like, oh, that's
exactly.
If you got a mental health problem, you go to see that, and then that was like, and everybody shunned it, So, but and it's up to us as employers and professionals to open up the realm of these services, so that we can best support our employees to better attract and retain, and to keep them happy at work and engaged in their work and producing their best work. I mean, that's the job of a manager, really, is to remove obstacles and get things done. And part of that is really caring about your employees. I mean, these are the things that are critical.
Well, that's a great point, Sam and Elaine. I actually do have an employee that has a daughter that is really struggling with mental health, and and it's really tough on an employee worried about providing the mental health resources. And I would say right, it's very, very important that particularly during the COVID recovery period, we're learning that our students, right, many, many young people, college age, high school, young youth are really struggling with their mental health right now. And then if employees have no idea that there's that mental health benefit, what a waste.
Right, right. And it's not just, most of the companies that I've been involved with, it's not just the employee, it's anyone in their household.
Right. And if you're a parent, a struggling parent, a single parent, we know a big percentage of single parents out there. It's very, very distracting. So in our culture, Susan will attest to this, right, Susan? We're a very transparent culture. Almost to the point of default.
Sometimes to a fault. Yeah, exactly. Mhm.
But because we are a big HIPAA company and we talk about health and compliance constantly, we know our boundaries, right? We do have boundaries about getting too involved in our employees' personal lives. But when we can point to a resource like Elaine or all of these other benefits that Elaine has brought forward, I mean, Elaine, if you, I would say anybody that's participating or listening on this as a recording on YouTube or LinkedIn, reach out to Elaine, man. I would tell you, Elaine, you have told me so many benefits and resources. It's like, I really just need a,
Literally, there are notebooks full of benefits and resources in communities that, just like Sam said, that no one really utilizes.
But that's what's really cool about it. I mean, your CFO is going to love you too, right? The financial people out there, the CFOs are going to say,
yeah.
Well, you're saying that we have all these resources and it's not going to cost the company extra as long as we have a solid basic benefit program. But the fact that you're going way above and beyond and educating your employees about all these resources in the community or in the nation or globally,
Mm-hmm.
I mean,
Mm-hmm.
I have to tell you, my employees, right, Susan? I mean, I'll tell you, I have employees saying they'll never want to leave us. And it's good. And because we bring in guest speakers like you, and we bring in people to talk about how to help you in your life and achieve your goals and take care of your kids and take care of your parents and take care of yourself, right?
And
Susan,
the more,
absolutely.
And I think the more that we talk about this with our employees, it kind of tears down that negative stigma of, oh, you have a mental illness. It's like, you know what? It's fine. Tear down those walls and make sure everybody knows it's okay to have an illness, to have, a mental illness, a physical illness, a disability. It's okay. We don't want to get too personal into it, but constantly talking about health and how we can help promote our employees is exactly why they don't want to leave. They've never experienced anything like what we have to offer, not only just the benefits package, but as far as our leadership support as well.
And the fact that we do different types of things, I have to put in a plug for TMA, Sam. We do different things relative to how we coach our employees. And so we use something called the TMA, which is, I'm going to just jump into it, Sam, okay?
Sure.
This is our sponsor. It's called the TMA method. We utilize the TMA method on the competencies and performance management processes of our company, because we're not just about numbers, although the numbers is where our paychecks come from. But we use the TMA one to hire, to coach, to mentor, and it's a positive psychology tool to really open up the dialogue. And then what I found, since I'm doing one-on-ones with all of my, well, at least my leadership level, is that sometimes these discussions come out. So for example, I have an employee that's constantly missing work because she has her mother's ill, or I have an employee that is, constantly distracted. The TMA tool is a great tool to start the conversation. And then sometimes it gets into more personal information. And then you can say, okay, here's your resources, or call Elaine. She might be a great resource for you and your family. Or here is a page of some of the links that might help you. And so the TMA is a great conversation starter. And also what we use the TMA for is if somebody says, you know what, I graduated college now and I want to be an epidemiologist or whatever their dream, or drummer. The TMA method also has, or this tool has an app, and I love this app. I go crazy about the app. There's an app, it's called, hey, Sam, help me, what's it called?
I think the app is well, it's the competency. Well, there's a competency library, but I think that I can pull up the app real quick here.
Yeah, there's a great app. It's like a career coach type of app. It's free. And I have actually every day, or usually not every day, okay, every employee meeting at some point I mention it, right, Susan?
Oh, absolutely. And we use this. I use this app all the time. I've used it to create my interview questions, to go over competencies during review time, and really, you know, the TMA itself to really go through what drives people, what motivates you, what type of jobs will you excel in, what do you enjoy doing. So it really helps you get to know your employee, not on a personal level, but more on a professional level of what drives them and what motivates them.
Mm-hmm.
Yeah, from a compliancy standpoint, we in our organization, we don't really talk about our product too much on this, but we can't really be talking specifically about our product, but we can definitely talk about competencies, behaviors, even attitudes. And this particular employee, Elaine, I'll just mention, you know, she was on the phone a lot, probably trying to address her medical concerns. Elaine?
Yeah,
And,
I'm sure she was, because the thing about it is, she, whatever job she has, right, she cannot afford to not have that med. She cannot afford to come off of those meds.
Right.
Because
and so
she'll come out of her mental.
So it's a perfect balance of using this TMA method of opening up positive psychology conversations, and talking about behaviors and performance. And then oftentimes those medical conversations start to come out, right?
Right.
They'll say, I'm sorry, I'm distracted at work. I'm not present at work. I'm really, really worried because I'm coming off my parents' insurance and I'm looking at these major bills. I have no idea. And in fact, I don't know if I can stay at this job because I don't think it pays enough for me. These conversations come out, so I can say, give Elaine a call. Maybe she can help you.
That's right.
And you've actually been doing that complimentary for a couple of my employees. So I really appreciate that, Elaine. Thank you.
Oh, that's fine. That's fine.
All right, so we're approaching the top of the hour, so I do want to mention that our next week's speaker, and that next week's speaker is me. So yeah, so I'm going to be next week I'm going to be talking about performance and employee performance and how that's being evolved through the. I mean, if we look back 10 years ago, there was the annual performance review, right? And actually, that is still the most dominant form of performance management that is out there. But many companies are switching gears. They're moving to different types of performance feedback. You know, either real-time performance feedback or quarterly assessments, different things like now. So I'm going to take you through the journey of what high-performing companies are using now and how they're developing employees, and it is related to the TMA method. I'll show you how that can be used to help develop your employees. Now, you don't have to be have the TMA platform to be able to do this. You can develop this on your own, but it'll be a fun conversation. So looking forward to it.
Well, I can't wait to hear what you have to say, because we're in that journey as well. And even Susan and I have been talking about a training, what do we call it? A training roadmap, Susan?
Yep, a roadmap to success. Yep. A
roadmap. So, so our employees know that we're not your typical employer, you know? If you get away from those HR terms, HR, as I say, blah, 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 it really turns people off to hear a lot of HR terminology. Okay. And as I say, I'm a recovering HR politician. I was the one that used all those terms. But now I think our employees appreciate that the owners and the managers and the directors are real humans with authentic conversations. And it's not just about, quote, performance management and the performance eval, right?
That's right.
So I can't wait to hear your thing next week, Sam. And hey, Elaine, I love you so much. You have been a dedicated listener. You've been participating. Thank you so much. How can people get in touch with you, Elaine?
You you can get on my website. It's HIMPAA.com. Health Information and Patient Advocacy Associates.com.
I'm just typing it into the chat right now so people can find it.
Perfect.
And you can also find me on the different patient advocacy, registries.
Now, how many board certified patient advocates are there in the nation, Elaine?
I believe that, well, that they are testing right now again. So I believe that when I got my registry, they said 987 registered, board registered patient advocates in the United States.
So we need more of you.
It's very popular on both coasts. I can only find in the state of Colorado where I live, I can only find 10 patient advocates actually.
Amazing. Well, thank
It
you all
is.
so much. Thank you, Elaine.
All right, thank you.
Elaine,
Thanks for the invite. And thanks Sam and Jules for all your attention. And I apologize for my Zoom.
All right.
Okay.
Yeah.
Thank you, everyone. Have a wonderful
Thank
week.
You too.
You too.
Bye.
Bye.
Bye-bye.